live. It's Dr. J here in the house. If you're enjoying these live streams, put your comments down below. Let me know what you think. Also, make sure you share with friends and family. Make sure you hit the bell for notifications so when I am live in the future, you get updates on your app. So what is happening? What is going on? I got my questions here dialed in. I'm going to just bring it on screen so I can see it a little better. All right, so off the bat, Morgan family writes in, Dr. J, what's the best way to test for celiac disease? My grandson needs to get tested. So a couple things. Celiac disease, conventional diagnoses tend to be late stage. So they're going to be looking at, if it's an endoscopy, which is a camera down the throat, they're going to be looking at villus atrophy. Typically like 80% villus atrophy is what they're looking at. So you can have some level of atrophy, some level of inflammation, but it may not be enough, may not have been long enough. So that's number one. Number two, they may look at specific antibodies to transglutaminase or endomysial antibodies. And a lot of times these antibodies are later stage damage-wise, so there may not be enough damage to constitute a full celiac diagnosis. And then you have other markers like, let's see here, that'd probably be those would be like the big ones. Now you can do more sensitive markers like the DNA testing, which gives you more of a genetic predisposition look. And if you have that genetic predisposition, then it's safe to say that you should avoid grains 100%, not just gluten. Now, when it comes to genetic predisposition, these are the HLA DQ2 and 8 markers, and there's also the 1, alpha 1, beta 1, and the HLA DQ3 as well. So if you have any of those markers, especially the 2 and the 8, we want to keep grains out of your diet. So the genetic test would probably be the better one, because genetic predisposition will manifest as stress and inflammation occurs. There's a greater chance that now you're going to be intolerant or sensitive to gluten. So keep that in the back of your head. Daniel writes in, my doc wants to put me on statins for high LDL. My HDL is 108, my LDL is 235, total is 360, ratio 2.2, triglycerides 26. Should I worry about it? Worry or no, my doc? Been on a paleo template for the last 3 years. So first thing is your numbers are on the higher side. You know, your trigs are good. Trigs are 26. That's almost a little bit low, but typically I'm worried about higher trigs. Your HDL is 108. That's really good. So your ratio of HDL to total cholesterol is like 3.6, 3.5. That's a pretty good ratio. So with that ratio being what it is, I wouldn't worry too much at all. I would want to look at your thyroid, make sure your thyroid numbers are optimal. Lower thyroid function can cause higher overall cholesterol, but your HDL, which is the cholesterol recycler, you hear on like the news or TV like, oh, good cholesterol, bad cholesterol. Wrong. It's the same cholesterol. The HDL and the LDL are the bus, right? The HDL is the bus that goes to the liver, back to the, from the body back to the liver. So it's the recycling bus, and then the LDL is from the liver back to the body, right? They're just different buses. The cholesterol is exactly the same. There's no good or bad there. But your cholesterol that goes back to the liver that's recycling your cholesterol overall is very good. So no problems there. I would want to look at your thyroid, and I'd want to look at overall inflammation markers like CRP, homocysteine, fibrinogen, and I want to also look at particle size would be great too. Doctor, can the 6 R's also help with Crohn's, colitis, diverticulitis? What is something that functional medicine cannot do and allopathic medicine can? Well, I mean, allopathic medicine is great for things that are acute. So anytime something is more acute, like, hey, you have sepsis, right? You're going to need IV antibiotics. You're going to need to be stabilized. There's a bleed, right? Anything more acute that's more life risk, when your kind of life's more at risk, that's where allopathic medicine's great. Functional medicine is going to be great when it comes to chronic things, because allopathic means for treating anything chronic tends to be more on the management side with medications and surgery, and it does not get to the root cause. Now, there could be some medications that could be a Band-Aid in the meantime that can be used as a Band-Aid while you work on fixing root cause. Or some patients that get in a massive Crohn's or ulcerative colitis flare, sometimes these medications can be helpful just to kind of put out the fire short term, but in the long run, you really want to be looking deeper for sure. Lampros writes in, what's the best way to treat for histamine and stool maybe? So first thing is cut histamine out of your diet and get the inflammation down. Histamine becomes more of a problem when your inflammation bucket is full. You can decrease histamine in your diet, and then you can also make sure you're digesting and breaking down your food. You can also do natural histamine degranulators like stinging nettle and bromelain and N-acetylcysteine. You can also add in kidney glandular tissue, which is very high in DAO, which will help metabolize histamine too. How many days a week do you drink coffee? I drink coffee every day. I can go with just doing decaf as well, but I just enjoy the taste, the smell, the aroma. And the big thing with coffee is I get great cognitive benefits. I finish my coffee typically before 9 or 10 a.m. every day, so it does not affect my sleep. Sebastian writes in, today I'm doing a carnivore diet and it's the only diet I can tolerate without having a reaction. Should I worry about my iron levels if I consume too much red meat, if it's grass-fed and organic? I wouldn't worry about it. I mean, it's also good to give blood, or if you're getting, blood tests once or twice a year and you're giving blood maybe once a year, you're going to be fine. And that's really good to know. So your gut's definitely reacting to the carbohydrates that are in there. So you're really cutting out all the inflammation. Maybe all the fermentable carbs that are being reduced are helping as well. Josh writes in, have you ever seen a well-managed program cause an exacerbation of manic depressive symptoms? I mean, it's always possible regarding die-off. So if you're having a die-off issue where your body's overwhelmed with bacterial overgrowth or fungal overgrowth debris, could that stress out your immune system or your lymphatic or your detoxification? Definitely. People that are super hypersensitive, any supplementation added too fast or too quickly or too much can be a potential issue. So that's why if someone's more sensitive, we always add everything one at a time, incremental. And then if we're having a die-off potential issue, meaning the symptoms are happening while we're killing things off, we really have to go slow and maybe look at more drainage and more detox support. How many numbers of months or rounds of herbal antibiotics are needed to extremely tough cases of gut infections before resorting to pharmaceutical antimicrobials? It depends what the infection is, number one, but typically 2 or 3, but it depends what the infection is. How many cups of coffee is considered healthy? I mean, anywhere between, I do about two cups or so. I do about 12 to 16 ounces of coffee, but I blend it with amino acids and I blend mine with MCT oil. So it's more of a meal. Anytime you blend fat in with the coffee, you time release the caffeine. So if you were to have an espresso shot versus a nice cup of coffee mixed with MCT oil and butter, that caffeine is not going to feel the same as the espresso shot. So when you time release it, it's a lot different. Time releasing, it's like having refined sugar by itself or after a good meal. It's not going to hit you the same way. But in general, I would say it depends. I would say 2-3 cups. I probably read at that max level, but it depends how you consume it as well. And if you do it early enough and it's not affecting your sleep, that's a good thing too. I seem to be reliant on HCl for digestion, been using it for a year with great success. How can I wean myself off? So first thing is make sure you followed all the 6 R's. Make sure your gut's doing great. The gut's under control. You're infection free. You're managing your stress. You're not hydrating with food. You're digesting your food well. You're regular. And then you can just gently start tapering down, or just use it for your more stressful time periods, right? You're eating more on the go, you're eating a bigger meal than normal, you're eating out, it's a holiday, whatever. So you can use it more at time periods that make more sense. And then when you're in a more parasympathetic kind of relaxed state, then you can start to do it more on your own. When you say 2 to 3 rounds, how many months is that? So a round would be about 60 days. So you're looking at, I would say 4 to 6 months. Sebastian, you are totally welcome on that. So yeah, coffee, I don't think it's a big deal. If you have a CYP SNP and you can't metabolize it well, you'll get anxious and jittery. That shouldn't happen. If that happens, you got to back off. Number 2, time releasing the caffeine makes a big difference. Using amino acids like collagen in it really helps as well. And then making sure your coffee is super high quality, right? It should be organic, pesticide free, and ideally low mycotoxin too. There's a lot of good brands out there. My favorite brand right now is Kicking Horse, and I use the Smart Ass blend. I love it. It's great. Javier writes in, really bad breath, body odor after sweating, stomach issues, and cough like phlegm after eating a big meal. So if you're having bad breath, there's definitely gut bacterial issues, and you're probably not digesting your food well. And so if you're having phlegm, there could also be some food allergens. So look at dairy first, look at any other big food allergens that may be getting slipped in there, that things that you would naturally pull out of a paleo template, right? Grains, legumes, dairy, refined sugar, milk, cheese, those kind of things. All right, any other questions, y'all? I got a patient I'm going to jump on here in just a minute. Just wanted to chime in here middle of the day, see what everyone is up to, see if anyone had some great questions, which you guys always tend to have some really great questions. I appreciate that. Anything else, feel free and let me know. If you're liking the Q&As, give me that thumbs up. Really appreciate it. Let me know in the comments things that I've talked about for you that have resonated or things that have helped you in the past. It really helps me to know what's going on. Have been drinking ACV in the morning and throughout the day. Had never had issues with acid reflux or anything, but I'm now feeling a little chest tightness, shortness of breath after consuming. So I did a whole podcast, or I did a video that came out this morning on this whole topic. So make sure you take a look at my root cause of acid reflux video. That's helpful. And if you said that you've been drinking ACV in the morning and had never had issues with acid reflux or anything, but I'm now feeling it, chest tightness. So what changed? Are there any food changes? Have you been increasing the HCl or the ACV? What changed there? That information will be helpful. Thank you, Korvac. Appreciate it. We'll keep up the great work. Ever since I went AIP 3 years ago, I've been having severe types of hypoglycemia. No amount of protein and fats makes me feel good as eating a high glycemic food such as rice. Solution? Well, it always just depends upon what your body needs regarding carbohydrate. So you can always just add other safe starches in and see how we do. Squash, sweet potato. Autoimmune diet is not meant to fix your macronutrients. So if you need a certain percent of macronutrients that feels well, an autoimmune template is macronutrient agnostic. So you can work on adjusting the macronutrients with your doc or yourself, and you can use safe starchy sources at the foundation and see what works best. Steve writes in, hey Steve, hope you're doing good. What's your go-to digestive supplement for undigested gluten or dairy? Love your podcast, bro. Awesome. Thanks, Steve. So anything that's going to be DPP-4 based is going to be great for gluten and dairy. There's a bunch of good companies that have that kind of enzyme. Claire Labs is a really good one that has its designs, has one called Allergyzyme that's pretty good that has those kind of enzymes in it. The DPP-4 is excellent. And of course, any extra protease and proteolytic enzymes will be helpful, but the DPP-4 is going to help the best. That's my favorite kind of go-to digestive support for gluten or dairy. And that's going to be better for more like incidental exposure. Like, hey, you know, maybe you're going to cheat a little bit, fine, but it's not an excuse if you have issues that you can just go out and do it, but it's good for incidental. It's good, hey, if you're going to maybe have a little cheat here because it's that time of the year, that's fine too. Aaron writes in, best herb for neuro, Lyme in the brain. So it depends, but Sida acuta is really good. Cryptolopis is really good. Those are some really good products. There's a couple of blends as well, but those are kind of some go-to ones. Cat's Claw is really good as well. Barb writes in, I've been on GI Clear 4, Biocidin, antioxidant, supreme, detox aminos yesterday. A rash appeared on the roof of my mouth. Could the things be making, could this be mistaking? I'm not sure what that last part is there. But yeah, you could be having a little bit of a die-off. So when did it all start? And if you're concerned, you can do a supplement holiday and add everything back in slowly and one at a time. So make sure you didn't go everything at full dose. If you did, it could be a die-off issue. So just kind of control those variables and let's see what happens. Cade writes in, Dr. J, can herbal antimicrobials used alone be beneficial bacteria? Can herbal antimicrobials used alone allow beneficial bacteria levels to increase without the use of probiotic supplements? I would never test that out. I'd always add probiotics in just to be on the safe side because we don't want fungal overgrowth or any rebound overgrowth. It's not worth testing that. So I couldn't tell you, but I would assume that you're going to have more problems not doing the probiotics on the backside. So I'd always make sure that's in there. Cat's Claws, I'm going to try that one. That's the one I'm drawn to. Cool. Awesome. Let me know how that works, Aaron. That's a really good one. I like that. Very cool. All right, everyone. Hope you guys enjoyed today's chat. I'll be back tomorrow morning, bright and early, 9:30 a.m. CST. I'll try to put the invite out tonight so you guys can see it and sign on. And hope everyone has a phenomenal day. Comments below. Really appreciate it. All right. Take care, y'all. Bye.